Good afternoon, everyone. I'm happy to be here with Dr. Hinshaw, our Chief Medical Officer of Health, to provide an update on COVID-19 in the province. I'd like to start with an update on our provincial rapid test program. With the global spread of Omicron and rising demand for rapid tests, there have been widespread supply challenges. We've seen this here in Alberta and right across the country. Fortunately, supply has been increasing. And last week, we sent more than 2.5 million tests to pharmacies and AHS locations across the province. We started making rapid tests available to the public in mid-December at participating pharmacies in Edmonton, Red Deer, and Calgary, as well as 150 AHS sites in the rest of the province. Last Friday, we invited more pharmacies to join the rapid test program. Since then, another 633 pharmacies across the province have signed up and ordered tests. That brings a total of 1,453 pharmacies distributing tests to the public across the province. I want to thank everyone in those pharmacies for their support. This is just the latest example of a partnership that has been one of the strengths of our COVID response from the start. I also want to thank all Albertans for your patience and the time it's taken to distribute these tests as we work through the supply chain issues. Now we're shipping another 2 million tests to the pharmacies starting this week, and all pharmacies should have received stock by next week. Participating pharmacies will be added to the Blue Cross website as they receive their tests. The list will continue to be updated as supply levels change, so if you're looking for a test, please check the website. With this expansion, we're switching to distributing tests only through pharmacies. AHS sites will no longer receive new shipments. That said, tests were sent out to AHS locations last week, so some AHS sites may still have tests available. As a reminder, every Albertan is eligible for a free test kit every 14 days as supply allows. Just show your Alberta healthcare card to get a kit. You can also pick one up for another person as long as you have a photo or copy of their healthcare card. We'll keep shipping rapid tests to pharmacies throughout February as we get them in. Looking beyond this month, we'll evaluate the rapid test program to determine how many more tests we need and for how much longer. Because, and we can finally say this, we're past the peak of the Omicron wave and we're transitioning to life on the other side of it. Now, that does not mean the pandemic is over or that we're still not at risk. There is still substantial strain on our healthcare system, and there will be for some time. We need to live with Omicron, and that means acknowledging that it's still a risk. We may need restrictions again if we see a resurgence, and we need to keep working hard to promote vaccination because that's the surest and least intrusive way we can keep COVID at bay. But right now, it's time to move forward. The evidence supports it, and it supports the decisions we've made throughout the Omicron wave. Over the past few months, we've kept businesses and communities open, and we've done this safely. We've reopened schools safely, and we have avoided overwhelming our healthcare system. We did prepare for the worst, a wave of cases that could drive hospital admissions critically beyond our normal capacity. We were open with Albertans. It was a real risk, and we supported AHS in preparing for this risk. But it did not happen. The number of patients in our non-ICU hospital units overall remained below their normal capacity and below the numbers at midwinter in the 5 years before COVID, 2015 to 2019. The purpose of restrictions from the start of the pandemic has been to avoid overwhelming the health system and help protect Albertans. It's now clear that this overwhelming of the health system has not happened, and it looks like it's not going to happen. Now, restrictions have a heavy cost of their own, and so it's time to move forward, starting with canceling the restrictions exemption program. It did its job, and now the need for it has passed. Albertans can still download their proof of vaccination, but the QR code reader apps will no longer be available. Now, does this mean this is just a normal year or that everything is fine? No, it does not. The numbers of patients in our hospitals are in line with midwinter and past years, but the strain on our system and our staff is still high. The pandemic has been the toughest time they've ever been through, and we owe them a huge debt of gratitude. And once again, I want to say thank you to all of our frontline healthcare workers, doctors, and volunteers that support Alberta patients. Our health system has been through the equivalent of 5 winters in the past 2 years. People are exhausted, and I understand that. The system needs relief, and it is coming. New admissions of COVID-positive patients peaked over 2 weeks ago, and they've dropped every day since. Provincially, they're down by nearly a quarter. In Edmonton, where the peak admission rate was highest, they're down by fully a third. That means that the number of patients in hospital will drop. It will drop soon and fast if we look at the experience of other jurisdictions that are ahead of us on the Omicron curve. The details vary, but the trends remain the same. In Ontario, for example, the number of patients in hospitals started to drop about a week after new admissions started to drop. It's down by half in the past 2 weeks. I know some people think we should have waited a little longer to see the numbers in hospital drop in a sustained way, but that assumes the number in hospital is critically too high right now. And the fact is, it's still within normal capacity in our non-ICU. It's higher than 100% at some sites, but the levels at those sites are also in line with midwinter non-COVID year. In fact, I see AHS today announce they no longer need the temporary overflow COVID sites that were established in Edmonton and in Calgary. So the question is, are the number of patients critically too high right now, like they were in the ICU in the fall during the 4th wave? The answer clearly is no. And that's why we don't need to wait. Hospitalizations are a lagging indicator. We know roughly where they'll go based on the case data and the new admissions data. We know the peak of Omicron cases is now weeks behind us, and this is based on wastewater and PCR testing data. We currently just have over 25,000 active cases, down 25% in the past week, and down by almost 2/3 from the peak of 71,600 on January the 16th. Based on all of that, we firmly believe hospitalizations will continue to trend down in the coming days and weeks, even as the restrictions exemption program and mandatory masking for children and youth come to an end. Now, we recognize that all Albertans have their own individual risk tolerance, and they have a right to feel safe in their own way. Some may be more at risk themselves or live with vulnerable people who are more at risk for severe outcomes from COVID-19. Or indeed, some may be parents who want to protect their young children who are not yet eligible for vaccination. I only ask that we give each other the space and consideration we all need to navigate through this transition period. Please respect others' people's choices and understand that we are all coping as best we can with this pandemic. And know that the health system is there for you if you need it. Emergency departments and EMS are under particular strain due to very high volumes of patients and strain on staff caused by COVID. But our hospitals and other services are functioning and they're safe, thanks to the dedication of all of our healthcare workers and doctors who work in them. In fact, hospitals are still doing near normal volumes of surgery, over 90% of pre-COVID levels. The waiting list is actually down slightly in recent weeks. This reflects lower levels of referrals due to the pandemic, and that demand will come back as we get the system back to working normally. The system is going to continue to be challenged as we gear back up. COVID is not a light switch that we can just turn on or off, but it's important to recognize the system is there for you. One of the things that keep me and other health ministers across the country awake at night is the thought that people are not coming in for care when they need it, apart from any reductions in services. So if you need help, please come forward and get it. And please continue to do your part and get all the vaccine doses that you're eligible for so we can keep moving back to a more normal life and a more normal functioning of our healthcare system. As of today, 40% of fully vaccinated Albertans 18 and older have received a third dose of COVID-19 vaccine to increase their protection against the virus. This is good progress, but we need more eligible Albertans to get this additional protection. Unfortunately, we have seen a slowdown in booster doses over the last week or so. We do have an ample supply of both Moderna and Pfizer doses available. So if you've been putting off getting that third dose because you wanted a particular vaccine, there's no need to wait. Book your booster shot today. In closing, once again, I want to thank Albertans for their perseverance and the sacrifices they've made to get us to where we are today. We can reopen safely because Albertans stepped up again and did the right thing to protect each other and to protect our healthcare system. And our health system is continuing to deliver high standards of care because of the dedication of our healthcare professionals. To every one of them, once again, I want to say thank you. And I look forward with working with you so our system can recover from the pandemic and build an even stronger system in the future for us all. So thank you. And with that, I'd like to turn over the mic to Dr. Hinshaw for today's update.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified 1,363 new cases of COVID-19 and completed about 4,986 tests. Our positivity rate for lab-confirmed cases is about 29.3%. Turning to hospitalizations, there are currently a total of 1,586 people with COVID-19 in hospital, including 126 in the ICU. Sadly, I must share that 22 new deaths were reported to Alberta Health over the last 24 hours. I send my sympathies to the family and friends grieving the loss of these Albertans. Their passing leaves a hole in their communities, as does the loss of anyone from any cause. As of February 10th, Alberta Education has advised only 4 of the more than 2,500 schools in Alberta are currently shifted to temporary at-home learning to address operational challenges. Alberta Education will continue to work with school authorities on shifts to at-home learning, and all requests from schools to shift to at-home learning so far have been approved. It is encouraging to see a continued declining trend. Less than 0.25% of schools are now on temporary at-home learning. Today I have some updates to share. The first is that effective February 16th, fully immunized workers in continuing care will be able to resume working at multiple facilities. I have talked about this change previously, indicating that it was coming. This move is intended to help facilities avoid staffing challenges brought on by limiting workers to a single long-term care or designated supportive living facility. It is also supported by operators and other continuing care stakeholders, many of whom were consulted throughout the fall and winter. The single-site staffing requirement was originally implemented in April of 2020 to reduce the risk of COVID-19 spreading across multiple facilities and putting residents and staff at risk. As you remember, the early weeks and months of COVID-19 saw high case numbers in continuing care, which sadly led to outbreaks and deaths among residents. Fortunately, vaccines have been extremely helpful in reducing the risk of severe outcomes, and we can now remove this restriction on fully vaccinated workers to mitigate the risk of sites not having enough workers to care for patients. The overwhelming majority of residents and staff are fully vaccinated against COVID-19. Approximately 80% of residents in long-term care and designated supportive living have received 3 doses of vaccine. Continuing care facilities will continue to have COVID-19 protocols and outbreak procedures in place as part of their day-to-day operations. These safety protocols, including continuous masking, enhanced cleaning and disinfection, health screening upon entry, testing and isolation when required, will continue at these facilities to protect residents and staff until Step 3. I want to recognize and thank the many operators, administrators, and staff in these facilities for the excellent quality of care being provided and for managing resource demands throughout the last 2 years. This has been challenging and exhausting, and I appreciate your work. Your efforts have helped prioritize staff and resident safety throughout the pandemic. The next update I have is about third doses for adolescents between the ages of 12 and 17 who have underlying health conditions, and also those in this age group who are First Nations, Métis, or Inuit. Bookings will start next Tuesday, February 15th for these youth. The additional clinical risk factors include underlying medical conditions such as diabetes, asthma, and other conditions that may put them at greater risk for severe COVID-19 illness. The list can be found on the Alberta government's website. In addition, adolescents between the ages of 12 and 17 with immunocompromising conditions will be eligible to book a fourth dose. This expansion comes at the recommendation of both the National and Alberta Advisory Committees on Immunization, because youth with these risk factors may be at higher risk for severe outcomes. At this time, there is no recommendation for third doses for all children and youth, since the 2-dose vaccine regimen remains very effective against severe disease for this group. Also beginning next Tuesday, we will open up third dose bookings for children aged 5 to 11 who have specific immunocompromising conditions as a part of their primary series. This is the same approach we have taken in all age groups for those who are undergoing cancer treatment, taking immunosuppressive medication, or who have another condition that lowers their immune response. For these people, a third dose in their primary series is needed to get closer to the response that non-immunocompromised people have after 2 doses. If your child is eligible and the recommended time has elapsed, please consider getting them their booster dose as soon as possible. This is a time of transition, and change is always hard. It is especially difficult when we are all exhausted from constant change over the past few years, and our communities are polarized. As much as possible, I ask that all of us seek to be gentle with ourselves and others. We need each other in our communities, and that will never change. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw. No one in person here in Edmonton. I think no one in person in Calgary either, so we'll go straight to the phones, please. We'll take the first caller.
Thank you, Matt Woodman, CTV.
Hi there. My question is for Dr. Hinshaw. We delayed the beginning of school so schools could prepare for COVID. This was at the beginning of January. The province ended up ordering millions of masks to protect kids in schools. They're beginning to arrive now, but starting Monday, they'll no longer be required in schools, although kids still do have the option. So what's changed over the last month or so? Has the science changed that masks are no longer effective tools for kids? Or what's changed that they're no longer necessary?
I would defer to Minister Copping to answer that question.
No, thanks for that question. And you know, we looked at in assessing this, we looked at the measures that are in place and the impact that it has, and the benefits we get from these measures. And as the Premier mentioned earlier this week, you know, we need to let kids be kids. We know that the impact on like COVID impacts kids. That tends to be less severe. They're less likely to get and transmit it. Although with Omicron, it is higher transmission rate than we've seen at Delta. We had heard as well as the concerns of the mask and the potential impact on learning, and also we've seen studies that there's a mixed review in terms of efficacy. And so when we were looking at how do we move forward in terms of the taking away the healthcare provisions and the restrictions that we had put in place to manage through COVID, we looked at those that were the least effective, and then actually had the greatest cost. And so that's why the first step was dealing with the REP and removing the REP, and then as well effective February 14th. Removing the requirement for masks in schools and for children 12 and under.
Thanks, Minister. A follow-up, Matt?
I do. Dr. Minister Copping, I'm not sure if you have any school-age children. Dr. Hinshaw, I believe you do. I'm just curious if your children will continue to wear a mask in schools.
So my children, again, I do have school-age children. Whether they will wear a mask or not, we haven't had that conversation yet, but I'll basically leave it as their choice. To if they want to wear a mask or not, because it goes to a degree of comfort, and this goes to the message that I said in my remarks, and also Dr. Hinshaw. There are individuals who may have different levels of readiness to move forward in this regard. They may have different levels of concern in terms of the impact on, if they're themselves or on others. So we need to be understanding about people, in terms of the choices that they want to make in this regards on an individual basis. So I do have children, and I haven't had that conversation with them yet, but I probably do so this weekend.
Thanks, Minister. We'll go to the next caller, please.
Thank you, Dustin Cook, Post Media.
Hi, thank you for taking my question. My question's for Minister Copping. Minister, tomorrow Edmonton City Council will debate possibly implementing its own proof of vaccination program after the province got rid of it earlier this week. The Premier has spoken out against this, saying that the city doesn't have the data. What data specifically does the province have that was the rationale to make this decision that the city doesn't? And why not release that data so the city can see it?
Yeah, so we took a look at our assessment of the REP, and as the Premier indicated earlier this week, but has also been discussed previously. The purpose of the REP, which was incredibly effective when we actually put it in place in the during the Delta wave, was to reduce transmission. It allow businesses to continue to operate. So either have be vaccinated with a QR code, or have a test to show that a negative test, and so businesses can continue to operate, and people be involved in going to restaurants and doing other entertainment venues, for example. What we've seen in terms of the data with Omicron, it is far more transmissible, and that the REP as currently structured with two doses, you're still seeing a large number of breakthrough cases. Some studies were showing with Pfizer with 2 doses, and this was in December, was ballpark 30% effective at reducing transmission. Although, just let's be very clear, vaccines have assisted us greatly through the Omicron wave, primarily for the reason that it helps protect against severe outcomes, in which we haven't seen a huge impact, although it's been challenging, but a huge impact on our healthcare system. So when we took a look at the original purpose of the REP was to reduce transmission, but given that vaccines, the 2 doses of vaccines were not very effective in terms of doing that, that's why we removed this. Because we didn't see the effectiveness. And also, as mentioned by the Premier, it creates some divisiveness within society. We need to start moving forward to learn to live with Omicron. We see the hospitalizations, new hospitalizations, has been coming down every day for the past 2 weeks. We've seen, we have a general trend line down in terms of hospitalizations, people actually in hospitals at this point in time. So we don't, it's time to move and reduce the measures. And then given the lack of effectiveness of the REP, that's why that was the first on our list to actually remove.
Thanks, Minister. Follow-up, Dustin?
I do, thank you. This one is for Dr. Hinshaw. Dr. Hinshaw, Edmonton City Council is also asking to see the recommendations that you made to the Cabinet Committee. Were your recommendations agreed to? And if not, will you agree to release them publicly?
All of the recommendations I make to committees of cabinet are protected under cabinet confidence, and it's not something that I have discretion about. So I'm not able to break the oath that I swore for cabinet confidence with respect to releasing my recommendations. That wouldn't be a decision of mine.
Thanks, Dr. Hinshaw. We'll go to the next caller.
Jason Markusoff, Maclean's.
Good afternoon. Thanks for taking my call. This is a question for Mr. Copping. I would like to know if the restriction relaxations and other rule changes on Tuesday were based on recommendations from Dr. Hinshaw. And while I can appreciate that you might be inclined to refer to cabinet confidence, I would like you to appreciate as well that Albertans have heard several times when you publicly said that you are following her recommendations. So please understand how an answer like that might sound to many Albertans.
Yeah, well, thank you for the question. Again, we take very seriously the recommendations made by our Chief Medical Officer of Health. We as a cabinet committee are balancing the needs of Albertans, not only protecting health and protecting people from Delta and Omicron and COVID, but also mental health, because the costs that they have with putting in restrictive measures, and then also the overall economy. And so in this case, we looked at the REP and the lack of effectiveness as currently constructed with 2 doses in terms of reducing transmission, seeing that wasn't effective, and we made the change. And I just want to point out that we have made changes like this throughout the majority of waves. Go back to wave 3, we had a phased approach, prudent. We're doing the same thing this time, a prudent phased approach in terms of removing measures. And recognize that as we've gone through this, each wave has been different. We have more tools available to us now than ever. Not only have we increased the rate of vaccinations and third boosters, but we also have antiviral drugs, and then also the nature of the threat has changed. Where COVID, the Delta wave was far more severe. Omicron is less severe and has different form of impact. So we as a COVID cabinet committee take all this into account and then make the decisions accordingly.
Thanks, Minister. Follow up, Jason.
Yes, thank you. I believe this question would be for Dr. Hinshaw, unless it's a political one as well. I wonder how long the data dashboard, probably Canada's best from Alberta on COVID, will last. We've seen that Saskatchewan has phased it out and stopped regular daily reporting, even to its officials. And given that there have been some similarities in how the 2 provinces have moved, I would like to know the future going forward for the Alberta COVID data dashboard. Thank you.
Thank you for the compliment. I'm sure all of the analytics team who work very, very hard on that appreciate the nod, because that has been a tremendous amount of work. So I just want to recognize the team that works on that. I don't know that a decision has been made about timing, so that's not something that I'm aware of in terms of a final decision. I'm not sure if Minister Copping would have anything to add.
Yeah, the only thing I will add is that at some point in time, as we move into the endemic phase, it will make sense to actually have less reporting. At this current juncture, I think it's important that we continue to maintain reporting as we go through our approach in terms of going from phase 1 to phase 2 to phase 3. But there will be a point in time where that level of detailed reporting will not be necessary as we move into an endemic phase.
Thanks, Minister. I was mistaken. I think we have a reporter in the room in Calgary. So we'll go to the reporter. Sorry, I don't know your name, but in Calgary, if you want to go ahead, please ask your question.
It's Jessie Weisner with Global News.
Oh, hi, Jessie.
This is for both Minister Copping and Dr. Hinshaw. I'm hoping for clarity on specifically what's needed to move to step 2 when it comes to hospitalizations. Is there a previous benchmark number like we've seen in previous waves, or what specifically constitutes a continued decrease? Like, do we need to see dropping numbers every day for 2 weeks?
Yeah, so thanks for the question. We don't have a specific number in mind. Hospitalizations, is going to be a key indicator. That we need to see a decreased strain on the healthcare system, but we'll also be looking at other indicators. So both leading indicators, the number of PCR tests, what the wastewater data is showing it. That's going to be important, as well as the new it's not only actual hospitalizations, but new hospitalization rates. So we're going to take that all into account as we move through it. But we need to see trend lines continuing to go down.
Thanks, Minister. Jessie, follow up.
Yeah, just on the QR code comment 4. So you said the vaccination QR code app will not be accessible anymore. I know the Premier said businesses could continue asking for proof of vaccination if they would like to, but how is that possible without being able to authenticate the vaccination code in the app?
So two ways. So first of all, even though the app is no longer available, the way that it works, you do not need it to talk back to a server. So once someone's got it downloaded on the phone, and actually most locations who are using the QR code have already downloaded it and have it available. So that will continue to work for quite some period of time. We just won't be updating the app, and you can't download it new again. And then alternatively, if other businesses continue to through this transition phase continue to ask for it, they can also. We will be continuing to allow Albertans and maintain the ability to print out the QR code and print out the actual, like if you look at the QR code, it has all the dates and the numbers in there as well, so they can actually just do a visual check. So there's, for those businesses that want to continue to use it, the app is there and it still works even though you can't download it, or they can do a visual check on the code.
Thanks, Minister. So since we caught one extra question in the room, we'll take one last caller, and then we'll wind up after that. So we'll take the last caller, please.
Thank you, Dylan Short, Postmedia.
Hi, Mister. You spoke about this a little bit during your opening remarks, but I've heard from several people within the healthcare system that basically just say, the plan, they don't have really too much opposition to your plan that was announced Tuesday, but that it is coming in early. We've heard that, multiple leading indicators are showing that we are in step for a decline within the hospital. I was hoping you could explain a little bit more why you decided to move forward with this week rather than waiting a couple more weeks to maybe give the hospital a little bit of a break.
Yeah. So again, we've been like with any wave, we start planning. We know that the wave will come up, and then we know the wave will go down. And we start planning ahead of time in terms of, okay, what are the measures we're going to take place? We have seen since January 16th a decline in cases. We've seen even that number, so our wave in terms of community spread appears to have peaked about then, and that's backed up by wastewater data. And then for more than 2 weeks, we've actually seen new hospitalizations dropping like a rock, and that's so. We know that the actual in hospitals is also going to follow that trend, and so and our approach generally is we try to manage this so that we put the measures in place that are required, because each the measures that we put in place, they have a cost. And they have a cost on impact on social activity. They have a cost on impact on economic activity, and so we try to put them in place when necessary, and then reduce them as soon as we are able. So given all these trends, we know that the numbers are going to come down. I fully appreciate, and once again, I thank all of our healthcare workers for the work that they are doing into supporting our system, but those numbers are going to come down. And so by making this move now, we are trying to reduce the impact and the negative impacts that these measures have. And I guess I'll make one other point. We went from the fourth wave with almost no changes in the healthcare measures straight into the fifth wave, and we actually increased them. And so we are mindful that there may be another wave. I am hopeful, based on all the conversations that Dr. Tam, for example, has indicated that we are likely moving into an endemic phase, but there's no guarantee of that. So, trying to limit the impact to the greatest extent on Albertans, and then part of our job and the job that the Premier gave me as Minister of Health is to do contingency planning for whatever comes at us next. So we're moving now because it's safe to do so, and we're trying to limit the negative impacts that these measures have on Albertans to the greatest extent possible.
Thanks, Minister. So for the final question of the day, Dylan, your follow-up?
Yeah, it's in terms of the REP, the counter-argument to removing it based on the fact that, 2 doses doesn't provide the greatest protection against Omicron. I've heard from several people that say, well, why wouldn't the government amend it to include a booster dose to get into some of these places? Could you explain why your government chose to get rid of it rather than do that, rather than amend it to have a 3rd dose?
So, I fully appreciate, and I've heard that argument as well. Why haven't we do that? Because we're actually coming out of the fifth wave, right? So adding more restrictions on doesn't make any sense when the wave is peaked. New hospitalizations have come down. Community spread is coming down. So in that context, and you're quite right, from a theoretical standpoint, adding the third dose will, to an RAP would help reduce transmission in those settings. But if we don't need to reduce the transmissions anymore, why would you do it? You wouldn't, because at the end of the day, our focus, and it has always been on protecting our healthcare system capacity and protecting Albertans. Albertans, can get their protection through vaccines. And again, we urge all Albertans to get their boosters if they haven't, and get vaccinated. And in addition to that, we have protected our healthcare system. The numbers are coming down, so we don't need additional restrictions or additional measures. What we need to do is reduce those measures at this point in time.
Thanks, Minister. We'll wrap up the questions there. As always, if you need anything else and we weren't able to get to you, please follow up separately. So thanks, Minister, and thanks, Dr. Hinshaw.